word, but we're still in our cardiovascular. So let's go. So what is Raynaud's disease? So Raynaud's disease is vasospasm. So let's pause for a moment and let's go over vasospasm. So when we have vasodilation of an artery or anything, we then have dilated, meaning it's relaxed, right? When we have vasoconstriction, constricts. It constricts. It narrows, right? But when we have vasospasms, it's a spasm. So when you're spasming, what is not being able to go through in your arteries? Oxygen-rich blood, right? All right. So doing this, and it happens you will see it in your fingers and in the patient toes, right? So this vasospasm occurs when there is exposure to cold or in stressful events. So you want to teach your patient that, okay, it's going to be 20 degrees today. This may not be a day you want to be outside, or you want to make sure that you bundle up, right? All right, and even stressful events and stressful situations and stressors in their life, you want to tell them, hey, you will start to see this if you're stressed out. So the finger or the toes start to feel numb or they tingle. And why? Because blood is not getting to that area. So then once you remove the cold or the stress goes down, the color then comes in, right? With a prickling sensation. So I want you guys to think, because we just talked about it with PAD, why do you think there is a bluish color or a white color in the finger and the toes? Let's see, do you guys know? And you are correct. Because of what? The lack of blood flow. The lack of blood flow. All right. So with Buerger's disease, this is a result from inflammation of the vessels and clot formation, right? So this mainly happens in your hands and in your feet. And this happens with people who smoke a lot. Heavy tobacco use. So this slide is the signs and symptoms and kind of just comparing the two. So with Buerger's disease, you can have a red, blue or red or pale tinge fingers or toes, small painful sores, skin changes, cold hands or feet, burning and tingling pain, and pain when walking. So remember, with Buerger's disease, it can be either venous or arterial. So we kind of can remember from PVD how these had some similar things, similar signs and symptoms. So with Raynaud's, that patient could have white fingertips. Why? Due to the lack of blood flow. They could be blue due to the lack of oxygen. And once blood returns, their fingers return red. All right. So what are we going to do if we have a patient who has Buerger's or Raynaud's disease? Well, I can say, as my years as a nurse, I never encountered a patient who had it. But if I did, to know that there is no cure for it. So we want to treat the cause for the patient actually having that. Like they have an arterial problem, they have a venous problem, but there is no cure. So we want to do lifestyle modifications, right, to lessen the severity of these diseases. Medications such as our vasodilators, our anti-inflammatory, pain medicines, anticoagulants, and antibiotics if the patient has an ulcer and it then gets infected. So the goal is to improve blood flow. In some cases, they may even need amputation. So remember, if an extremity goes with blood, oxygen-rich blood for a long time, what can happen? It will die. It will die. Our body, our extremities, we need oxygen and blood to function.